Okay, let's get right into it. When you or someone you love needs care, you just assume there's someone making sure it's safe, right? Well, in England, that's supposed to be the Care Quality Commission, or the CQC. But here's the thing, this vital watchdog is in the middle of its own crisis. And today, we're going to break down exactly what has gone so wrong. Wow, you really can't get much more blunt than that. This isn't from a critic or an anonymous source. This is from the nation's top health official in July 2024, basically declaring that the one organization responsible for patient safety is failing. So the big question is, how on earth did we get here? And what does this actually mean for millions of people? So to really grasp the scale of this problem, let's be super clear on what the CQC is. It was set up back in 2009, and its mission is, well, simple but absolutely massive. Regulate and inspect every single hospital, care home, GP office, and dental clinic in England. They are meant to be the guardians of quality and safety for all of us. Now, the CQC wasn't just created out of thin air. Its very existence is a direct result of some truly tragic failures in the past that showed just how badly things can go wrong when no one is watching closely enough. And believe me, the stakes could not be higher. Take 2009 at Basildon Hospital. The CQC itself rated the hospital as good just 1 month before another report uncovered appalling standards that led to hundreds of deaths. Then, in 2011, there was the horrific abuse uncovered at Winterbourne View, a terrible reminder of what can happen behind closed doors. In 2013, the Morecambe Bay scandal, which led to accusations of a cover-up inside the regulator itself. These events show us exactly why a trustworthy, effective watchdog isn't some nice to have. It's an absolute necessity. So let's fast forward to today. A bombshell independent review known as the Dash Report has just laid bare the severe, deep-rooted problems that are plaguing the CQC right now. Get this. The Dash Report found that some hospital ratings are a full decade old. Just let that sink in for a second. 10 years. In that time, a hospital can completely transform. You could have new management, different staff, better safety protocols, or maybe things have gotten much worse. A reading that old tells you basically nothing about how safe that hospital is today. And this isn't just about out-of-date information. The CQC's most basic functions have just crumbled. The numbers here paint a really bleak picture. Inspections have been more than cut in half since before the pandemic. New care homes and services, they're stuck in limbo, with over half their applications delayed. A truly shocking 1 in 5 places the CQC is supposed to check has never even been rated. And if you're a provider trying to call them, good luck. You could be waiting nearly 20 minutes if your call isn't dropped altogether. So what on earth is causing this collapse? Well, a huge part of it was a huge internal restructuring that led to a catastrophic loss of specialist knowledge. People who were experts in, say, hospitals or maternity care were shuffled into generalist roles. The result? The Dash Report found inspectors showing up at hospitals and literally admitting they'd never been in one before. You can imagine how that went down. It just completely destroyed the CQC's credibility. And on top of all that, they rolled out a new inspection system, a new rule book called the Single Assessment Framework that seems to have made everything worse. It was supposed to be simpler, but with 34 different quality statements, it's become this bureaucratic maze. And the biggest problem? Providers say they're left asking a really basic question: what does good actually look like? The system just fails to give them a clear goal to aim for. And the problems with this new framework run even deeper. It has this shocking lack of focus on what really matters to patients, outcomes. It also ignores whether resources are being used efficiently, which is actually part of the CQC's legal duty. And maybe worst of all, it calculates its ratings by mashing together scores from inspections that could be years apart. It's created a system that just has no credibility. Okay, so the diagnosis is pretty grim, but is there a cure? Well, the Dash Report didn't just point out all the problems. It also laid out a very clear prescription for recovery. And here it is, a 7-step plan, which the government has now fully accepted. You can really think of it in 3 main parts. First, they've got to fix the internal machinery, get the basics working, sort out the failing IT, and just pause new work to focus on their actual job. Second, it's about rebuilding trust with the outside world by bringing back that expert knowledge they lost and totally overhauling that confusing assessment framework. And finally, the plan calls for long-term accountability, making ratings transparent and beefing up government oversight to make sure this can never happen again. So it's a clear roadmap, but the journey ahead is going to be enormous. The real question now is about the long-term prognosis. Can an organization this broken really, truly rebuild trust? And this is exactly why it matters so much. We aren't just talking about some government agency here. We're talking about the safety net for over 53,000 hospitals, clinics, and care homes across the country. Fixing this isn't just shuffling papers around. It's about making sure that when any of us are at our most vulnerable, the care we get is safe. Period. So as the CQC begins this, let's be honest, pretty painful process of reform, we're all left with one crucial question. Will this 7-point plan actually be enough? Will it finally create the strong, credible, and effective watchdog that England's health system and every single one of us deserves? I guess only time will tell.